Hey everyone, I'm really excited to be here. My name is Claire Brandon, and I'm a psychiatrist. I work in New York City, and I subspecialize in gastrointestinal psychiatry. And a lot of you may say, well, what is that? And I'm glad you asked because we're going to talk about that all day in this presentation today. My talk is talking about how to make a mental health team part of your healthcare team. And what that means, what that looks like. We're going to get into all the nitty gritty details. So I'm happy to be here with you guys, and I hope you're having a wonderful day so far. So this is just a little bit about me. My background is being an adult psychiatrist as well as a consultation liaison psychiatrist. And I did all my training here in New York City. So that's where I'm situated, wherever you guys are watching in the country or in the world. And I specialized in gastrointestinal psychiatry. I found it really rewarding. I love working with GI patients. And that's mostly what I treat in my private practice. So we'll be talking a little bit about what that looks like. So just a really rough agenda that I want to talk with you guys about today, answering some of these big questions about how to make mental health part of your medical treatment team. And we're going to answer some of these questions, the what, who, how, and why, but we're actually going to answer them in a slightly opposite direction. I want you guys to understand why mental health care is important as a first and foremost. And when I thought about the task of talking about how to integrate mental health into your treatment team, I think the best thing that I can do is give you a little bit of a landscape of what that might look like so that you know how to advocate for yourself, you know how to talk about mental health and who to look for. So let's start off. We're going to talk a bit about the why. Why think about mental health as part of your treatment team, right? So this is a bit of a rough outline. We're going to go into more detail on some of these, but as a starting place, mental health is health. Lots of people think that physical health is the only thing we're talking about when we think about health. And certainly, people that have gastrointestinal issues and disorders, that is a big primary part of what you're looking at and what you're thinking about for your healthcare. But how does mental health actually impact your quality of life? And how might that impact your gastrointestinal disease? We'll talk a little bit more about that. We're also going to tackle this idea of what is the brain gut axis? Many of you might have heard of this, and it's sort of a cool term that people are throwing around. But we're going to really talk about the nuances of what that looks like and why that's important to think about when you're integrating mental health into your treatment team. We're also going to tackle inflammation very briefly and thinking about how inflammation from your gut actually impacts your mental health. And keep in mind as we go through this talk a little bit that, patients that are struggling with medical conditions, whether that's gastrointestinal, neurological, any kind of infection, all of these things, they actually end up having improved outcomes when they're working on and targeting their mental health from a stress perspective, from a coping skills perspective, and lots of other things. So we'll talk about that a little bit as well. So, mental health care's impact on quality of life, that's the QOL there. Um, one thing to really think about, and what I talk a lot about with my patients for the impact on their quality of life, is that when you're dealing with a chronic medical condition or even an acute medical condition, we have to think about ways to redefine life with that condition and how that impacts us and how our mental state and our environment impact our viewpoint on that. Maybe it's the interpretation of feeling like you're ill or feeling that you're disabled in some way, or maybe life just isn't exactly the same as you thought it would be before. But working in mental health to that and thinking about that, talking about that, and saying those thoughts out loud actually has a really significant impact on your quality of life because you don't have to feel that everything is circling around your GI disorder or your medical condition. We can think about this from other ways and interpret it in other ways. Which brings me to this idea of catastrophizing. In mental health and in therapy, we think about catastrophizing as somewhat of a distortion, a thought distortion, right? Everything seems like the worst case scenario at all times. And that can certainly feel like the case when you're dealing with medical tests, doctor's appointments, doctors, hospitalizations, all of those things. It sometimes feels like everything is the worst that it could be, and that's where our minds go. But when you're working on your mental health and thinking about the stress and coping that goes into that, it's super, super important to think about other routes of outcomes. Not that everything is the worst or has to be the worst or is going to be the worst. And that can actually, and has shown in studies, that your quality of life can improve just by changing some of your insight about that and your mindset about that. Now, the next thing I want to touch base on is this idea of the brain gut axis. Lots of gastroenterologists know about this, and they might even talk about it or throw that out there. You might have come across articles about it on the internet. But what does it actually mean, and why is this something that's important to think about in integrating mental health care into your treatment team? So, going way back into embryological origins, so when you're just forming as a human, the brain and the enteric nervous system, or this huge network of nerves that are dealing with your gut and helping your gut move the way it's supposed to be moving, they're all coming from very similar places. So they were all connected at once and then they separated a bit. But from even a developmental standpoint, this is a big connection. And in research studies and in thinking about this, we notice and are noticing more and more through research that there's this bidirectional communication pathway, meaning the brain impacts the gut and the gut impacts the brain. And that's actually linking these emotional and cognitive centers with the functions of your gut. So if you're really, really stressed, then your gut is probably feeling really stressed too. And lots of my patients notice this as they're tracking their symptoms, as they're tracking their mood. Lots of things overlap and correlate. And that's a real good indicator that your brain gut axis might have a dysbiosis or is not functioning the way that we would hope it would function in a seamless, concentrated way. Untreated mental health conditions can actually make your body feel like it's in fight or flight mode. You've probably heard this, right? And I always joke with my patients, it's sort of like you're constantly running from the bear. You can't stop, you're just running. Your body doesn't really take a chance to calm down and settle and do the functions that it's meant to really do well, like digest your food or feel that you can have a bowel movement that feels complete. So in thinking about this and thinking about the brain gut axis, how this all works together, we want to try to target your mental health symptoms so that your body and brain don't feel like you're running from a bear all the time. We can settle down some of those mental symptoms so that we can settle down some of the gut symptoms. Now, the next piece to think about is inflammation. And a lot of you are probably very well versed in inflammation. I have a simplistic drawing here, and it's really, we're going to utilize this as thinking about this splinter, right? Everybody's had a splinter. Probably everyone can relate to that. Ouch, painful, it hurts. It's not supposed to be there, right? And it's impacting the body in a way that you end up with pain, blood cells. These are white blood cells. They're targeting this area of injury in your body, and it's resulting in fluid coming into the area, swelling, redness, warmth. We see all this when maybe your finger has a splinter in it. But if we think about a gastrointestinal issue as being this splinter, something that maybe isn't supposed to be there, then we can see that all of these things might be impacting how your GI system is reacting. Now, that's a really simplistic view to think about, but if we think about mental health conditions, they're doing very much the same thing, causing inflammation, causing a disruption of the immune system, and creating these antibodies, right? Autoantibodies, inflammatory factors, things that are really kicking up in our system so that our body thinks, again, we're under duress, something is wrong. And mental health symptoms can be mimicked by this, and they can be a result of the inflammation as well. So if you're having a lot of anxiety, your whole body can feel inflamed, kick up your GI symptoms, and vice versa. If your gastrointestinal symptoms are feeling really intense, you have a lot of inflammation going on in your body, then that can result in feeling anxious or having a hard time adjusting, a lot of stress going on. These things are just really, really interconnected. And these are just different ways to think about how the brain and the body are really interacting. And then coming to this other topic, this final piece of the why component as to getting you on board and having you think about why it would be helpful to have the integration of a mental health team with your gastrointestinal team or your medical treatment team. We see improved outcomes with mental health. So actually treating your mental health can help to change the inflammation that's potentially worsening your medical issues. When stress hormones are kicking up, that's like a cortisol release in your body. And again, this idea of the inflammation, the idea of the dysbiosis of your brain and gut axis, it can increase your heart rate. If you've had anxiety, or even if you've had really painful or uncomfortable symptoms of your gastrointestinal disorder, you've probably noticed this. Your heart rate might feel like it's getting faster. Potentially, you have higher blood pressure. And after a long time, you can have the stress hormones that are kicking up in your body can actually result in elevated blood sugar levels to make it look like almost that you have a diabetic condition or more prone to diabetes or metabolic disorders. And then, of course, I think we can all sort of think about this that increased stress hormones cause GI dysfunction, right? All these things we're putting together, we're thinking about how the brain can impact the GI functioning and therefore GI dysfunction. So, if we're not controlling some of these stress hormones that come on with anxiety or depression, then we're not doing everything to control the GI symptoms either. So, moving on to the next piece of this puzzle and thinking about your integration of mental health into your medical team, we want to think about who would you be looking for, right? Who is working in mental health? Mental health is a very generic term, and there are also some things that have stigma in mental health, could feel very scary to you. Often when patients meet me for the first time and they've never met a psychiatrist before, they say, "Well, hey, you're not so scary." And I'm happy to be the first person that they meet to have that experience. But thinking about what a psychiatrist is, what a psychologist is, and there are other players in mental health as well. But we're going to try to target today just thinking about psychiatrists and psychologists who might be really subspecialized in working with medically ill patients or gastrointestinal patients. So, thinking about psychiatry, the iatry here refers to medical treatment, right? So, I went to medical school, I have an MD, and I think about medical care. I also assess all of my patients for both their medical symptoms when I'm working with GI patients. All of those symptoms that you talk about with your gastroenterologist are really important for me to know as well, because that way I can help to target some of those symptoms and parse out with you what's maybe anxiety related and what's really underpinning of your gastrointestinal disorder. It's also really helpful for me to be able to communicate with your gastroenterologist. It's a doctor to doctor relationship, and it really helps to inform all of the collaboration of care of your treatment team, which we're actually going to talk about a little bit later. I also prescribe medications. Although not all of my patients are taking medications, it is possible that they would be prescribed medications, and it's sort of a one stop shop for me to be seeing them for therapy as well as their medication needs. And, I've gone through thousands of hours of training, working with patients in my residency, fellowship, subspecializing, all in order to make sure that I can really treat you in the highest quality of care. Now, in comparison, a psychologist, the ology, right, the idea of this ending, how can we inform that to understand what they do best? That's the study of, right? So these are PhDs or PsyDs. They've done a ton of intensive work thinking about research potentially, looking at different studies of what benefits therapy have and how that impacts things. So they might be able to do things like psychological testing. If you've had a flare of a gastrointestinal disorder with all the inflammation that comes up for you, you might notice that you feel a little bit slower mentally or that you're not thinking as clearly. And so psychologists are really, really helpful in doing psychological testing, helping to understand what the cognitive impact of your disorder is, and thinking about ways to target that. they're often research focused. So they're sometimes in hospitals and academic centers, and sometimes they're in private practice. But they're also the backbone of us figuring out what things really help in mental health treatment as well. And then, the overlap here is that both psychologists and psychiatrists can conduct therapy. They don't all do the same, they don't all do therapy. Some psychiatrists don't, but they can. They have the potential to do that. So it's worth thinking about what would make the most sense for you in order to seek out someone in mental health. And, sometimes patients actually have a psychologist for their therapy treatment, and then they see me for their medication component. We're talking about sort of weaving that together. So I throw that out there to say there's lots of different options here in mental health care. There's lots of different people that might be working in this realm. Being a little bit more focused, psychiatry is actually a pretty broad term, and it encompasses a lot of different psychiatrists. So I'll throw out there that there are different types of psychiatrists, and that would include general psychiatry, child and adolescent, people that focus on kids, forensic psychiatry, where they're working in potentially prison populations, geriatric psychiatry, working with elderly populations and all the different medical illnesses that can come up with geriatrics. And then public psychiatry, which works on thinking about a public mental health perspective of care and treatment. Now, the one that my background is, as I mentioned before, and that I'm a bit biased for if you have a gastrointestinal disorder, is the consult liaison psychiatrist. So that's a fellowship trained psychiatrist that works with medically complex patients. And they've spent specialized time in doing that work so that they can think about the different interactions, side effects, and things that might be going on with your medical condition in coordination with your potential emotional mental health condition. And sometimes they've subspecialized in gastrointestinal disorders or other subspecializations as well within the realm of consult liaison psychiatry. But I throw that word out there so that you guys know the term, because a lot of people have never actually heard of a consult liaison psychiatrist. And it's someone to think about seeking out if you're looking to integrate mental health care into your treatment team. So now moving on to the how does mental health care even fit in, right? When we're thinking about everything that you're doing for your medical care, it's an investment. Every time that you're going to the gastroenterologist, every test that you do, you're investing your time and your energy and potentially your money as well in order to get treatment to have a better quality of life that we alluded to before. Now, when I talk with my patients, the goal is not that you have a mental health condition and that's why you have GI disorders, right? This is an integration. Those things are occurring simultaneously. One is not necessarily creating the other at all times. So a lot of patients feel frustrated that their gastroenterologist might suggest, or even here that I might suggest, it would be helpful to have mental health care in your treatment team. But again, what we're trying to target here is not the underlying cause of, say, your Crohn's or colitis, or even your IBS. What we're trying to do is help you cope with it and have a better quality of life by decreasing these inflammatory markers that might be heightened with an anxiety or depression or overall stress. And they can look like confusing, they could be confusing to your symptoms. So your gastroenterologist might tell you, you're in remission based on the testing that I can do, based on the studies that I can see. I don't know what else I can tell you. You should theoretically be in remission. But then you might have pain symptoms, or you might have chronic other symptoms that are really distressing for you. And that could be a remnant of the inflammation that's going on with the stress of having a chronic or acute illness. So, the other piece of this is having an objective outlet to speak to somebody that's not within your family, in your friend group, and talking about how frustrating this can be. Often, it's really wonderful to have a support network of friends and family, but when you're talking to them about what you're experiencing and what you're going through, it can be hard to find an objective perspective of that. Someone to help point out things that are going on with you that actually might be making your symptoms worse or might be resulting in you having more stress and anxiety. sometimes that can put tension on relationships, especially if they're part of your regular life. Whereas a therapist, so whether a psychologist or a psychiatrist, they're not part of your everyday life. They're someone that you're going to process these ideas and emotions. And it can be really helpful to talk to somebody, especially if they're specializing in GI mental health. It's also a way, especially if you're going to a psychiatrist, to have a little bit more time with a medical doctor. When you're in a gastrointestinal clinic, often those are really fast visits, especially after the first time you meet your doctor or you get diagnosed. Oftentimes, it's sort of a really fast in and out process. And you might have more questions and more thoughts to think about and process. And it's helpful to be able to talk more about that with someone like a psychiatrist. I generally see all my patients for 45 minutes, and we're thinking about all these things as they go along, including how to collaborate in your care with your gastroenterologist, which we're going to talk about a little bit more in the next couple of slides. And then finally, I'll put out an idea here that having someone on your mental health team when you're thinking about your gastrointestinal issues is really worthwhile because it might help you avoid the pathway of unnecessary treatments. Again, if some of your stress and anxiety or depression symptoms are mimicking or worsening your gastrointestinal symptoms, you might end up getting more medications, more treatment, more studies, even surgery sometimes that potentially isn't absolutely necessary if you could target some of those mental health conditions. So it's really worthwhile trying to seek this out as another alternative if you find yourself really struggling with remission when all other things seemingly would have worked, should have worked, and aren't going super well. Getting mental health involved can be the thing that gets you a bit over that hurdle. So, talking about the what, right? What is mental health? What is this thing that I've been talking about here now for some time? And we're going to get in a bit more of the nitty gritty of the details of what you might expect to get out of mental health treatment. Now, I've gotten two boxes here, either the medication management perspective of things or the psychotherapy management of things, right? Talk therapy. And often these are intermixed and combined, and that's really probably the best way to do treatment. If you don't need medications, then that's not on the table, but sometimes it's very helpful in medications and thinking about medications to help you get some traction on your anxiety or depression or stress symptoms. And talking with a psychiatrist about that, talking about the different treatment options, and thinking about ways to weigh out the risks and benefits of taking another medication, the side effect profiles of medications, and what that might look like for you, how that might be able to help you is really helpful and important. The other piece of this is psychotherapy. So, again, that could be a psychologist, that could be a psychiatrist, and there are different types of psychotherapy. So, it's worth knowing some of these terms. We won't go into extreme detail with these, but it's worth thinking about them. And if something sounds interesting to you, you might write it down and look more about it and see if there are providers in your area that actually do these types of therapy. So, supportive therapy is sort of what it sounds like. You're coming in, talking to somebody, expressing your frustrations, and potentially trying to figure out ways to communicate in different ways more effectively, talking to your treatment team, thinking about ways to navigate your illness. Cognitive behavioral therapy is actually using a skill set where you're learning how to really acutely treat some of the anxiety, depression symptoms that you might be experiencing. And sometimes with cognitive behavioral therapy, there are handouts, there's homework, there's tracking. And so if you're really visually oriented or you're thinking about ways to target the here and now symptoms that you're experiencing, that might be a really cool pathway for you to check out. There's also biofeedback and mindfulness. I think this is super important for gastrointestinal patients because it really helps to allow you to get back in tune with your body, right? The brain gut axis that we've been talking about and decreasing the inflammation, having a good sense of what your body is like at a baseline by actually doing deep breathing, understanding how your body feels, and checking in with that can be really, really helpful and help you feel empowered about what's going on with your body. And then finally, although there are plenty of other types of psychotherapy, this is not an exhaustive list by any means, but coping-based skills in types of treatment like dialectic behavioral therapy. If you find yourself feeling on an emotional roller coaster all the time, up and down, things feel very stressful, and you have a hard time wrapping your head around it, this can be a really good type of therapy to develop your skills for coping in ways that you haven't thought of before and to help you feel like you can navigate more effectively. So, getting to this perspective of something called collaborative care, I've alluded to this a couple of times, and that's because it's really, really important to think about collaborative care when you're dealing with your gastrointestinal issues. Now, collaborative care in actual definition is more like meaning that you are in a GI doctor's office and the psychiatrist is reviewing your chart as well. Maybe you're seeing them and maybe you're not. So, in the specific terms, that's not exactly what I mean here. Although, if you have that possibility, it's worth thinking about in your doctor's office. But thinking about collaborative care, I'm talking more about collaboration, right? Lots of times my patients ask me, how do I get my doctors to talk to each other? Whether that's a surgeon and a GI doctor, psychiatrist and a gastroenterologist, a primary care doctor and your gastroenterologist, or other specialists. And that's a really important question in how to do that. Sometimes a psychiatrist can be very helpful in sewing that together a bit, having remember that doctor to doctor conversation and being able to reach out and be part of that treatment team can really help mesh that together. Another topic that I get a lot from my patients is I don't feel comfortable asking questions in my gastroenterology appointments. And that might be the speed of the appointment. That might just be that you think of the question after the fact, right? We always think about that best question once it's all over. And part of that is actually just training yourself and figuring out how to be an advocate for yourself, right? So, patient advocacy, that's actually the responsibility of everybody on the treatment team. And guess what? You're on the treatment team. It's your body, it's your disorder, it's your treatment. So you are a part of that treatment team. And part of mental health treatment is actually figuring out how you can advocate for yourself. You can work on communication skills, you can work on discussing these things with your doctors, writing down questions and asking them in ways that you actually get the answer. Or if you don't get the answer, feeling how you can actually get the agency and feel the agency to ask the question again in a different way. And that, again, working with a psychiatrist, working with a psychologist, that can be helpful both from the perspective of sewing together the team and also helping you to advocate. And finally, collateral information, which could be from your doctors, but it could also be from your family members, can be really, really helpful. That a psychiatrist, that's often part of our job, is getting extra information from all the people that know you better than someone who sees you for maybe a 15-minute gastroenterology appointment or even a 45-minute psychiatry appointment. So, collecting all that information, getting a better view of who you are and what might help you the most is part of collaborative care and why it can be really helpful and important to have mental health on your treatment team. So I've alluded to this idea of a toolbox a couple of times, right? And the idea of having these coping skills in your back pocket can be really, really powerful. Something that you want to try to get out of mental health care treatment. So, having coping skills, having a coping plan on hand for days that either you're not feeling well, maybe a day that you end up going to the hospital for treatment or for testing, and having tough conversations, whether that be with your family members or with your doctors, and how you want to proceed from that. That's all really helpful and important, and something that you want to make sure that you have in your back pocket for when those days come up. Working on understanding, what your chronic illness means to you is also really important. Wrapping your head around this idea of, hey, I have a chronic illness, but that doesn't define me. Or this is how I see my chronic illness, and this is how I see my life, and what my goals are for my life, regardless of that chronic illness that I'm also working on. And it can also be helpful in understanding your body better. So I'll throw out a couple of terms here that might be a really good starting place if you're curious or interested in thinking about, is mental health something that I want to pursue and incorporate into my treatment team? So ways of thinking about this are body scanning. There are a lot of good apps that will help you actually talk you through body scanning, figuring out what's going on in your body, where you have pain, where you have tension. Progressive muscle relaxation is another great tool to think about utilizing to help to decrease the stress on your nervous system so that, again, you're not running from the bear all the time. Progressive muscle relaxation can be very helpful for anxiety, can also be super helpful for insomnia. And then meditation, it's talked about a lot, and I think it's a scary topic because people feel like they have to be really perfect at it or incorporate it in large amounts of time in their life. And it actually doesn't have to be that way. You can do 5 minutes of meditation here and there throughout the day, and it actually can just be as simple as doing some breathing exercises. It makes a big impact, and it's just another small way that you can incorporate mental health aspects into your treatment team. So that's just a really brief overview of how to incorporate mental health into your treatment team. I want to throw out there that if you have more questions or you'd like to connect, please feel free to do so. I have a couple of different platforms to connect with. One is GI Psychiatry. That's me just working on with my gastrointestinal patients. And in the future, I'll be having some podcasts and some social media aspects to the GI Psychiatrist. You can also connect with me through my private practice, my website, Whole Body Psychiatry, where I have a blog and we can talk about things and connect, and I can try to answer questions in that way as well. So it was really great to be here with you guys. I hope you learn a ton in Hill Day, and looking forward to staying in touch. Take care.